Welcome back. Doctors use all sorts of technology to see the inner workings of our eye. We're joined today by Dr. Thomas Stone. You're from Retina Associates of Kentucky.
Right.
And good to have you with us today.
Good to be here. Thank you.
And you're here to tell us a little bit about this camera called the OPTOS, right? And
That's right.
It's a camera that takes a 360-degree picture of the eye.
Right.
What's important about this camera?
Well, you know, this is a camera that we've been using for a couple of years now, and what it does is normally the old technology, it was sort of like going into your bedroom with a flashlight. You could kind of flash a light in one little small area, but you wouldn't be able to see anything else around. This one is like turning on the room light in the room. You can see everything all at once. And most of the diseases we see and treat, usually diseases with the blood vessels, don't have one little area where it's affected. Usually it's a broader area. And being able to see this area sort of in real time allows us to more precisely figure out if there's a problem with each patient and then best how to treat that and keep them from losing vision.
And you said it's important also because of particular patients, and you'd get referred, you would need this eye photo.
Right.
Because of perhaps you have diabetes, you said, or
right.
A particular problem if you see your eye doctor.
Yeah, most of the time we use this for folks who have blood vessel problems in the eye, and the main cause of that in our day and age is people with diabetes, high blood sugar, and that affects a couple different parts of the body, but the eye is one of the main ones. The kidney is the other that people have problems with. And we can see the blood vessels much more clearly with this technology. There's other things that do affect blood vessels in the eye. Sometimes people have little strokes in the eye and things like that, and we're able to treat those now too. But to learn, you know, where exactly in the eye this is it makes a big difference, because if it's in one spot, we might treat it with a laser. If it's in another spot, we might not treat it at all. And if it's in a broader area, we might have yet a third treatment.
Okay, so this is a full picture of the eye.
Mm-hmm.
This is an unusual technology. Also, you said there are about, what, 20 of them in the U.S.?
In the U.S. But I'm not sure about internationally, but basically this is a company out of Scotland. And it was developed by a man whose child was misdiagnosed because they didn't have the proper imaging technique, and his son had lost some vision. And so he said, you know, we can do a better job. And he's developed, there's two types of cameras. There's one that just takes color pictures, and there's probably hundreds of those in the U.S. Mm-hmm. Ours has an added capacity of being able to image the blood vessels. And they're still trying to figure out the technology. I think they're making a lot of the parts individually at this point, so that's why they can't mass produce it.
Okay.
And we were able to get in on the ground floor on this. And I don't know of any in the region, certainly none others in Kentucky that I know of. There's some in Colorado and California and New York. But we've been able to use it the past several years really to help a lot of patients.
Very interesting. And if someone is at home and maybe they're having eye issues, when do they need to come see you?
Yeah. Well, certainly diabetic folks who have had high blood sugar and are being treated for that need to have an eye exam once a year. That's the recommendation. And a lot of times you can have no vision problems and one day wake up and not be able to see out of the eye from diabetes. It's that kind of disease. So seeing your regular eye doctor once a year is important. And then typically what happens is, you know, should there be a threshold of problems, they would then send them to see us.
Okay. Well, thank you so much, Dr. Thomas Stone, with us today. Thanks for coming on the show. And we will have more with you guys for you guys' news and weather coming up.